Documenting notes for each patient is a very important part of your work at ATS. Your notes, whether evaluations, visits, reevaluations, or discharges, need to be completed and submitted to the ATS office by midnight on the day of the visit. In this video, you will see how to properly document evaluations. To document notes, bring up Hotbox. You will see a list of all patients with the visit type next to it. Under the appropriate date, find the patient's name whose note you're wanting to document and click on the corresponding visit. When you open the evaluation, you will see the visit type in the top left-hand corner. Please make sure that the visit type is for the correct discipline and is scheduled appropriately. For example, if you are a physical therapist, make sure the evaluation scheduled is for PT. Below the visit type, you will see the patient's name. When documenting, be sure to always confirm the patient's identity, then check the box next to Patient Identity Confirmed. The next thing you will see is the time in and time out. The time you're in a patient's home doing an evaluation must be documented correctly using military time. The minimum time for a visit is 30 minutes. It is not acceptable to have a visit that is less than 30 minutes. For patients who have Blue Cross Blue Shield insurance, the visit will need to be longer. Specific times will be documented in the details. Next, you need to make sure that all dates match. Choose the visit date, then check to be sure it matches the date in the top left-hand corner. If it does not, you will need to update the target date in the patient's chart to match the date that the visit is completed. The medical diagnosis and your diagnosis will then need to be input. You will then need to fill out the information regarding the patient's relevant medical history, prior level of functioning, and the patient's goals. If the patient is unsure of their relevant medical history, you can contact the ATS office to get further information. Under Patient Goals, please note that you will document the patient's personal goals, not the treatment goals that you are setting for that patient. Note any precautions and then choose whether or not the patient is homebound. If the patient is homebound, check the box beside Yes and then note why the patient is homebound. If the patient does not appear to be homebound, please notify the ATS office as well as the patient's home health agency to inform them of the situation. Social supports and safety hazards must then be noted. Document who the patient is living with or if they are living alone, when assistance is available, and the type of assistance received. Check the boxes next to any safety or sanitation hazards that you find, or if there are none, check the box next to No Hazards Identified. You will then write a short evaluation of the living situation, supports, and hazards. Next, you will see a place to document patient vital signs. Refer to the notes given to you at the time of your orientation for those agencies that require vitals, as well as the parameters for those agencies. The physical assessment for the patient must then be documented, followed by a pain assessment. Always note pain and intensity, or if there is no pain, check the box by No Pain Reported. You must note pain for each note, or the note will be sent back to you for correction. Continue noting physical assessment, and you will then document the functional assessment for the patient. Here, you will note the assist level for bed mobility, gait, transfer, and any other information related to the patient. Note the DME that is available to the patient, then enter your evaluation assessment summary. Check the box next to any functional limitations, then move on to the patient's treatment goals. List out the treatment goals here along with the time frame in which the patient should achieve these goals. Please make sure you are setting definitive goals. Avoid setting goals that will be constantly ongoing. There needs to be a list of detailed goals that have a definite end. Under Treatment Plan, check the boxes next to the type of treatments the patient needs to undergo in order to reach the stated goals. Under Care Coordination, you will see the conference with. Please note who you are coordinating with regarding patient care, their title, and what the conference is regarding. Note your statement of rehab potential and treatment skilled intervention this visit. You will now finish up by recording your cert dates, effective date, and frequency. Cert dates will automatically be in the note, but be sure to double check on the patient's chart that the cert dates are noted correctly. Put in your frequency for the eval and the effective date. Always note the effective date so we know where your frequency begins. The effective date should be the date that you do the evaluation. Under Discharge Plan, check the appropriate boxes, then you can choose to save the note or submit. If you need to finish documenting at a later time, you can choose to save the note. The note will still be available in your hotbox for you to complete. When you are finished and ready to submit the note for scheduling, input your electronic signature along with the signature date, then choose Submit. Please make sure the signature date corresponds with the visit date noted at the top. The evaluation will now be submitted to the ATS office where it will then be scheduled out to the appropriate therapist. In most cases, an assistant will go out to do treatments for a patient. But if you have a patient you think would benefit from remaining on your services, please notify the ATS office staff. You can notify the office by phone or K-mail, but the easiest way is by putting the information in the Details section. Simply click on Details next to the evaluation, then note that you prefer the patient to stay with you for visits. Once the note is submitted, it will be removed from your hotbox. Please note that you do have the ability to save your note as a template. This can be useful when you have patients with similar symptoms. Choose to save answers as a template, then type in a name for that template. The information will now pre-fill if you use the previously saved information. To use a saved template, scroll to the top of the note, then choose a saved template next to Use Template. Next, we will go over regular visits and how they need to be documented.